Dr. Stephanie Waggle here. I was just out on a brief 12-mile run, and I was thinking a lot recently about trying to get people to take antipsychotics, especially for psychosis. So I listened to an NEI CME podcast during my run that brought up a lot of good points that I wanted to share. One is that whenever somebody is sick with psychosis, the organ that is actually malfunctioning is the organ that you need to make decisions. It's the decision-making organ. It's your brain. So because your brain is malfunctioning, you're not going to have good decision-making capability. So when someone recommends to you to take an antipsychotic, you're probably not going to have the insight into your illness to say, yeah, that's a good idea. In fact, lack of insight is one of the characteristics of psychosis. So there are actually 3 million people approximately in the United States that have schizophrenia, psychosis type picture, because if there's 300 million and it's 1% of the population, that's a rough estimate. And so if you think about why is it that people's decision-making capacity, and just to be clear, capacity is determined by a psychiatrist and competency is determined by a judge. And I've actually sat in several competency trials in the courtroom. If you think about an elderly person with dementia, typically they end up being forced to take their medications and going to a nursing home. You don't really see people with dementia just walking around on the streets by themselves, but you do see people with schizophrenia walking around the streets by themselves, especially in big cities. And one of the reasons that could very well be is that because dementia patients are the geriatric population, so they typically have family members taking care of them, whereas the schizophrenia patients in the just general adult population may not have kids taking care of them yet, or they're too old for their parents to be taking care of them. So the lack of family support leads to them not getting the right medications and the help that they need. So the lecture I listened to was on the ethics of involuntary treatment, and it talked a lot about life versus liberty. And so your autonomy and liberty is obviously very important, but is it as important as keeping yourself and others around you safe from harm? And that is where the involuntary treatment picture comes in. And it's really sticky and a hard decision to make, and that's why having family members that are supportive is really important. And Dr. Stahl in the podcast actually said that 25% of the inmates in prison in LA are on antipsychotics, and that made me think about some people that I treated in the past. Typically what happens if you're psychotic and you don't take an antipsychotic and you don't get treatment, you'll get arrested because the behavior that you're exhibiting is not such that people are going to just accept in society, that people are going to call the police on psychotic behavior. And the police are typically not trained to handle mental health situations. And so if you don't get in the mental health system for a psychosis, you will most likely end up in the prison system. And I'm not really sure the prison system is the best system to be taking care of psychosis. So the point that I'm trying to make is, one, people that have psychosis typically don't want to be or can't understand why they should be placed on antipsychotics. And quite frankly, the side effects to most of the antipsychotics aren't really great. I mean, there's some that don't have as many side effects as others, but in general, they're not great side effects. And the person with the problem with their brain isn't going to be able to make the determination that that's a good move or remember to take it or that sort of thing. So it's really important that family members participate in the care. And if you are a family member and you're hesitant to get your loved one treated for psychosis, just remember that the most likely thing that's going to happen, unfortunately, is that if they're walking around out there in public with a psychosis, someone may call the police on them, and they're going to end up in the judicial system instead of a healthcare system. And so if you had to pick between the two, I think doctors and nurses might be better equipped to handle these situations than police officers and lawyers.